My name is Christian Dalsgaard. I'm head of the Smart Textile Alliance, a non-profit organization set up in London to standardize the smart textile application and the technology in e-textile. This is a bit outside my experience, but I'm sure that you will love to hear about skin compatibility, battery user experience, how this new world of creating non-invasive monitoring wearables will impact the health sector. Today we have Robert Batchelor, who is in charge of the development of this wearables, and I will hand over the screen to you.
Great, thank you, Christian. So hi, as Christian already said, my name is Rob Batchelor, and I am the head of Biosensors here at Nutromics based in Melbourne, Australia. Before I get started with my talk, I just want to thank Christian as well as the rest of the organizers here for giving me the opportunity to go through these slides with you and talk about our data so far. So today I'd like to talk to you about continuous molecular monitoring wearables and how they're the next step in medical wearables after continuous glucose monitoring devices. So as you probably know, analytes are the key to clinical understanding. Clinicians really want to know exactly what's going on inside a patient's body. But except for glucose, which is involved in diabetes, the rest of these analytes and all the others that we know of, troponin, BNP, glutathione hormone, vancomycin, drugs, metabolites, vitamins, biomarkers, all these things. In order to get that information, clinicians have to take a blood draw, send that down to the lab, and then wait for the lab results. The best one that gives you the data really quickly is the glucose, and that's generated by the continuous glucose monitors. So continuous glucose monitors are great. They give you a chance to provide real-time concentration of glucose in the body. And this is based on enzymatic transduction of glucose concentration to an electrochemical signal that can be translated into an electrical signal that can be read by Bluetooth and then just goes straight to your phone. This is great for millions of diabetics across the world. The great thing about this is that it only detects glucose. Of the thousands of other potential analytes that could be sensed, it doesn't see this. The downside of this is that it can only detect glucose. So enzymatic sensors, of which glucose is one, are not a platform. Every time you want to generate a new assay, you have to find some enzyme and target pair that work well together. And in the last 30 or so years, only a handful have been generated. The others, besides glucose, are glutamate, choline, lactate, and acetylcholine. These are not a platform. It's not something that's easily modifiable and to identify new targets. Aptamer-based sensors, which will flow into continuous molecular monitors, are a modular platform. By simply switching out the DNA aptamer, it allows you to modify which target and tune which target you want to identify. There's over 50 different papers if you look online, and then identifying over 12 different targets that all have been identified in the last several years by our collaborators and labs around the world. So continuous molecular monitoring, or CMM, is the next evolution of CGM. Enzymatic sensors, or CGM, can only detect metabolites such as lactate, or glucose. Aptamer sensors can also detect those metabolites, but they can also detect other target classes such as drugs, proteins, hormones. And aptamers have also been made to cells, viruses, as well as small metal ions. These are a true platform technology which will allow us to move forward in more continuous molecular monitoring. So let me show you here our prototype device. This is a solid state device that's just a few centimeters across that would just sit right on top of the skin and interrogate just a few hundred microns into the skin painlessly and bloodlessly using the microneedles on the pink disc that you can see there. The fundamental science behind this is the electrochemical aptamer-based sensor. And so as we zoom in on just the electrode, which are based on the microneedles, you can see here that we have aptamers with a redox sensor shown up at the top. And then when we have a complex milieu, and in this case, that's specific for a drug that's going to show up, this causes a shape change in the aptamer, increasing the electrochemical signal. Because you can simply switch out the DNA aptamer, this allows you to target